Hello everyone, welcome to this live session. We will have Dr. Deepa, she's a pediatrician. She will be joining us and we will be talking about the issue of gas and constipation in babies. So I'll just get her in. Hi Vidya. Thank you so much everyone for joining. Hi Rubina. Thank you for joining. Hi Isha. It's so lovely to see so many of you saying hi. Thank you
Hey,
so
hi.
much. I would love to see many more highs. Hi Vidya. I'm just
Hi.
waiting for Dr. Deepa. So once she's here, we can start off.
Yeah. I think she's messaging me. Just a minute, I'll
Okay.
just let her
Okay.
know.
In the meantime, like everyone who has joined, if you all are having any questions, please post them. If you see at the bottom of the screen, you can see an icon with a question mark. It's better if you post your questions in there because then they will not get lost. I can read them out one by one and Dr. Deepa can answer them. Hi, Manisha. Hi, Shagun. Hi, Jyoti. Thank you so much, guys, for joining.
Okay, I'm just telling her, okay? Give me a minute.
Yeah, yeah, with them. Hi, Sneha. Hi, Niti. Shatavari is good for breast milk. I'll wait for Dr. Deepa to answer that. A request to everyone, please post your questions in the question box. You can see it as a small icon at the bottom right corner of your screen. Yeah, she's joining with you.
Yes, she's
Yeah, in the
joining.
meanwhile, maybe you can give some introduction about Dr. Deepa.
Okay, I'm just guiding her. One second,
Sure.
huh? Yeah, she's pinging me on WhatsApp.
Okay, we are receiving questions. We will get them answered. Hi, Surbhi. Hi, Sneha. Hello, in the end of session, we will ask now. You guys can keep sending the questions. So,
Hmm.
depending on the number of questions, we may have to shorten our session and answer your questions. So, yeah. Hi Priya, I can see your question that my 3-month-old daughter's legs sometimes shake, or you can say like vibrate for a few seconds. Is this an issue? Okay, we will take this question up, Priyanka. It would be great if you can post it in the question tab. It's taking some time for Dr. Deepa to join, so just hold on, guys.
Yeah.
Be with us, and she will be joining any minute now.
Did you send a request to her
You are
for to
not
join?
really audible, Vidya. You're very low.
Okay, ma'am.
You want me to
Okay,
send her?
did you? Yeah. Send her.
Oh, okay. There's an issue with Dr. Deepa's Instagram. It looks like she needs the latest version of Instagram to join.
Oh, okay. Let me just call her and join back. Uh,
Mm,
uh,
yeah,
I'll just call her and join back. Yeah, you be
yes,
glad.
please.
Yeah.
We are so sorry for the delay, guys. It looks like Dr. Deepa is not having the latest version of Instagram. So we are on it. Uh, she should be able to update it and join back. In the meanwhile, I'm having your questions. There are a lot of questions. Let me just note them down. And we're extremely sorry for the delay, but Dr. Deepa will be joining us as soon as possible.
Yeah, she's updating.
Okay.
Okay, she's there.
Hi.
I'm sorry for the
Hi.
inconvenience. I
No
No,
issues.
no issues, no issues.
Yeah.
Yeah, I think we
okay.
can start. We have a lots
Yeah,
and lots of
I,
questions
I
already.
saw that.
Yeah.
Okay. So Dr. Deepa, I will start off with the questions. Actually, Instagram is now like, it's making a lot of updates and
Yeah,
yeah, even I'm
and
seeing so
I
many
don't
people.
usually use it unless and until I have some sessions. So that's why I think I haven't updated it. Okay.
Yeah.
Yeah.
Okay, I'll start with the question.
Mm-hmm.
Um, the first question is, can I, Vidya, let's keep our questions on hold and let's go on with the questions of the audiences first. Yeah. Okay, so the first question is, can I give gripe water for my 5-month-old baby?
Okay. So first thing, we usually don't prescribe or recommend any use of gripe water, but it has been, in Indian traditional, it's like it has been passed on since generations. They kind of give it to the babies. No significant harm or this thing noticed. So that's why I personally don't prescribe any gripe water. So from me, it's a no.
Thank you. Thank you, doctor. Next question is from Priyanka. She says, my 3-month-old daughter's leg sometimes shakes, or you can say like vibrates for few seconds. Is this an issue?
If it vibrates and when you try to hold it, then it stabilizes, then it shouldn't be an issue. It's what we call as jitteriness. Happens sometimes in the newborn baby. But even with pressure or when you try to hold it and control, it still continues to vibrate, then it should be of concern and you should consult your doctor.
Okay. Thank you, Dr. Deepa. The next question is, my newborn, 23 days old, is always gassy. Is it because of something I eat? How can it be avoided?
Okay, it can be due to many reasons. First of all, we don't know whether your baby is exclusively being breastfed or is it on formula fed or it's on both the feeds. And secondly, gassiness and all these infantile colic or abdominal issues usually start after the baby is somewhere around 3 week old. Okay, so now your baby is somewhere around that age. So that can be an issue, and sometimes improper latching at the breast. If the baby is taking in a lot of air while feeding, that can also be an issue causing all this.
Okay.
Okay, thank you, Dr. Deepa. Sada, you have just written melasma, so I don't really know what your question is. If you can please elaborate it, it would be great. And there's one question asking about what is gastric problem.
Okay, it's a very wide question actually. Any because gastric problem can be constipation, can be gas trouble, can be colic, can be diarrhea. See, all those things come under the gastric problem.
Yeah, thank you, Dr. Deepa. There's another question from Dhani. Will it be okay if my 4-month-old baby poops for 5 to 6? No, wait, will it be okay if 4th month baby poops 5 or 6 days once? I guess she means like once in 5 or 6 days.
Once in 5 to 6 days, yeah. If baby is exclusively breastfed, gaining weight, comfortable with this pooping schedule, then yes, that is okay.
Hi, Harshita. I'm good. How are you? Okay. Yeah, there's another question by Dipali. Whenever I give Similac plus formula milk for my baby, it causes gas.
Okay. So if you have good amount of breast milk, it's better to continue with that because formula milk has again some other different kind of protein structure and sugar and lactose and all that. So it will be a little different from what breast milk is there for, which is will be exclusive for each baby. So yes, if the baby is having gas issues with the formula feed and if it's not that much necessary, you can always continue with your breast milk.
Yeah, thank you. Um, the question of gripe water is back again. We answered that question already. Like once we post this session video on our feed, you can have a look if in case you've missed it. Sadaf is having melasma treatment. I'm so sorry, Sadaf, that is not part of our discussion right now. But we can definitely plan to have a session with a dermatologist for this. So, yeah, moving on to the next question. Again, like when can I exercise after C-section? I'm so sorry. In this live session, we are discussing only about the gas and constipation related issues related to baby. But still, like since that question has come up, would you like to say something, Dr. Deepa,
About
if you would like to, like exercise after C-section?
okay, exercise after once usually the healing and the puerperal period usually is there up to 45 days, ideally 6 weeks they say. So if your scar site and all is healed, you are comfortable with the pain and your feeding schedule and sleep schedule has been set, then I think after 2 months is good to go. Maybe after 6 weeks you can start some light exercises like walking in the same room or something like that. And then after 2 months you can go ahead. Building up your stamina is much necessary first rather than directly, starting some heavy exercises, which can unnecessarily cause muscle injuries.
Yeah, thank you, Dr. Deepa. Harshita has a question. My 2-month baby cries while peeing, while passing
Okay.
the urine.
Okay. So we don't know if Harshita's baby is a male child or a female child. Okay. So male child sometimes they have their foreskin, genital foreskin quite tight. Because of that, they tend to put on a lot of pressure while peeing, and once they pee it, then they are quite comfortable. And sometimes due to that discomfort, that sensation of being bladder being full makes the baby cry. And once they cry and they pass out, and then they are relaxed. So, Harshita, if you have a male baby and if the foreskin is quite tight, kindly consult your pediatrician once and to assess that genital foreskin. And if it's a female baby crying constantly, then we'll have to see if there is no urinary infection. Okay.
Okay, thank you, Dr. Deepa. There's another question by Nishu. My preemie corrected age is 6 months and is teething and on formula feed since birth. Please help. I didn't get the question, Nishu.
Yeah.
Dr. Deepa, were you able to understand anything out of
No,
it?
no, no. She's mentioning
Yes.
everything, but what exactly she wants to know, she isn't mentioned there.
Yeah, Nishu, so please reframe your question. Um, yeah, the next question is how to release baby from gas and constipation.
Okay, first of all, whenever and wherever possible, breastfeeding will be a very good option. And during feeding, good amount of latching, proper latching technique. Make sure your baby doesn't suck in more amount of air while feeding at your breast. And if the baby is bottle fed, then make sure the nipple of the bottle is completely filled with milk when you give it in your baby's mouth. That is regarding the feeding. And post feeding, make sure you take the baby on the shoulder, or maybe if not on the shoulder, make him comfortable in a proper position and burp properly. So more amount of burping that half the gas is passed out there. And then you can give them some tummy time, some good amount of massage for the tummy. You can have a lot of videos are available for the what kind of massages to be done for the tummy online. You can just go and search them. Whatever you are comfortable with, you can go ahead and do. So it will help.
Yeah,
Doctor,
next
just
question.
want to ask one more related to the same. Does the hing balm, there are they
Yeah.
also apply hing paste. Is it effective?
Uh,
Can it be used?
Uh, See, to be very frank, there is no proper documentation of how effective it is, but make sure anything you apply to baby skin is not so much irritant that, because of that irritation, it causes something else. Because sometimes
Okay.
these days, even hing is not available in pure form,
Pure.
and unnecessarily that chemical can cause irritation and all that. Yeah, sometimes at homes they do that, and baby feels comfortable also. But this gas and all that is, no, it's a very tricky thing. Can last for few hours and then suddenly disappear as if there is nothing that has happened.
Hmm. Okay.
Yeah, thank you, doctor. The next question is from Priyanka. How to know my breast milk is enough for my 3-month-old baby? I don't understand. So I give her breast milk as well as formula milk,
Okay.
Nanpro. One of the most
Okay.
most
See,
common question.
yeah. Okay, see if baby is gaining weight, is satisfied, having good amount of naps or sleeps as per schedule, and you passing good amount of urine. Say maybe since your baby is 3 month old now, maybe some 6 to 7 times if the baby is passing urine, that means she's getting adequate feeds. Judging just how much baby wants or to tell you that this much amount would be sufficient would be a wrong thing because every baby's need will be different. At every feed, the need would be different.
Yes. Yeah. The next question is by Pooja. Pooja, the same question she's asking, when to exercise after C-section. We already answered that question. It was answered by Dr. Deepa. In case you have missed it, please have a look at the video once we post it on our feed. Next question is solution for rashes in face and neck. I don't know if she's referring to the baby or herself. Yeah, I'm moving on to the next question. So, Fatima, can you please elaborate on that question and then we can take it up? Ragini is asking when babies start gaining weight. Okay, I guess she's asking when will babies start gaining weight after birth?
Okay. So, baby's birth weight initially, whatever would be recorded on day one of life, they tend to lose some 10% of it until 10th day. Okay. So, 10th day, tak then they'll have that regain the birth weight. Maybe if the baby is 3 kilo, by 7th, 8th day, it would be like 2.8, something like that. So 10th day, tak they'll go back to their birth weight and then slowly start gaining after that. Maybe 25 to 30 grams per day. So this is as per the book, but again, it depends upon baby's sleep, baby's feeding and stuff. Okay, so yeah, after 10th day of life, baby should start gaining weight.
Okay. Surbhi, you are asking us about gas and constipation. This was already answered in the video, in the session. We will be posting this video and you can have a look at it. So you should be able to find your answer. Santoshi is asking, my 3 months baby boy frequently spits up milk. Any suggestion?
Okay, spitting up milk is usually normal, but it again depends upon baby's overall well-being and weight. If the baby is spitting up continuously large amounts and causing it, a discomfort, maybe followed by, irritability, excessive crying, and not gaining weight, then you definitely must discuss this with your pediatrician. And if maybe it's some curdled milk, twice or thrice a day, baby is vomiting, otherwise comfortable, and then gaining weight also, then nothing to be done.
Okay, the next question is from Darshat. She's asking, my baby is avoiding breast milk. Why? Why is it so?
Okay, so see, if the baby is bottle fed along with breast milk, then definitely there will be a thing called nipple confusion, wherein the baby will stop taking the breast milk and start continuing with the bottle milk. So we don't know if your baby is on bottle and breast both.
Okay, there's a suggestion from Surbhi over here. She's asking if Dr. Deepa can tell us more about gas and constipation. Maybe, like, a lot of questions will be solved by itself. So,
Yeah,
how do we
actually,
want to do it?
Vidya, what your questions, no, I think we'll go by that. So a lot of
Yeah.
queries will be, cleared in that discussion, I guess.
Yeah.
Yeah.
Yeah. The first one is yes, the first one is why do infants face gastric issues?
Okay. Their gut system is quite immature and they have just been born, they are just being fed. Milk itself contains a lot of nutrients in that. So they are in a stage of maturation because and there will be growth of bacteria, the normal flora, what they call. All this causes little bit of gastric problem. Exact reason behind why this typically thing occurs, nobody knows, but there have been many theories put forward.
Okay. So can a baby be gassy and constipated at the same
Yes.
time?
Yes. Gassy and constipated, definitely yes. So because of constipation, baby has not passed stools, baby is having little pain, baby tends to cry. Crying causes lots of air to go in. That again causes gas. So yes, they can both go hand in hand.
Okay. And how is colic and constipation related, or are they even related?
See,
Colic issue.
constipation, if the baby has not passed stools, baby has this little bit discomfort, and that can trigger that colic episodes and cause pain, and that triggering of any such episode leading to excessive crying, inconsolable cry, wherein the baby, cries for hours together without any reason, not taking feeds, creating literally panic among the parents. So constipation, and suddenly this thing might be relaxed if the baby has passed stools. So yes, constipation can trigger colic.
Yeah, is there any medicine that can really help colic, Dr. Deepa? Because um, like yeah, is there any medicine that can really help? Because babies do suffer with colic, and many
Yes,
babies suffer with
yes,
that. Doctors
yes,
term it that the baby is having colic, and that's why they are in that, like,
yes,
uncontrollable bouts
yes,
of crying. But
yes,
nothing
yes.
really helps. So
Hmm.
is there something that can really help?
There are many medicines on the counter available which can be given for this colic thing. Okay, some of them are really painkillers, which we keep it at the end if literally nothing works out and everything has been tried, then we go for it. Then there are some simethicone, dill oil, phenyl oil drops available. Okay, so they help to certain extent in relieving the flatulence or the gas. So indirectly relaxes the baby for a while, and then that colic episode passes on.
Okay. Okay. And are these issues like gastric and constipation related to any milk alone? Like, is it only does it happen more while when they are formula fed or during breastfed?
Right.
I mean, how is it related?
Okay. See, yeah, comparatively with breast milk, it is little on the lower side because it is exclusively made for the baby, for individually. Even for the twins, it is made in that way. Uh, but in formula fed, it's the same structure, same composition that's been followed, and that might sometimes affect little more. So I would say yes, breastfeeding babies would have little lower chances of colicky compared to the formula fed babies.
Okay, okay. I think we can again shift to audience questions, Dr. Deepa.
Yeah,
We'll again
but
come back.
um,
Yeah.
but I see an issue over here. Okay, we have like in the questions tab itself, we are having 27 questions,
Mm.
and like unfortunately, I'm not able to access that tab. It may be some Instagram
Okay.
issue. And apart from those 27 questions, we are having continuous questions coming up. So how do we want to take it, Dr. Deepa and Vidya, like
Let's
your
see,
suggestion?
on whatever, I mean, we'll continue with these questions. If something is coming common, we'll just keep them as per this thing. We can
Okay.
go, and many would come towards a similar one, I guess.
Yeah. So this question is from Nishu. My preemie poops after every meal. So she poops at least 4 times in a day and also passes gas. Is this okay?
It's okay until and unless she's gaining good amount of weight.
Okay. Next is from Afra. My baby farts a lot and spits up a lot. Is it because of giving both breast milk and formula combination?
Yes, that can be a possibility. There are two types of milk, two types of protein baby, and two types of content babies being exposed to. So that happens. Pooping and farting and spitting out. That does happen.
Okay. Sadaf, we are not really talking about melasma over here, so please, you can park your question for our next session when we have a session on that. Uh, if 4 month baby cries non-stop, then what should we do? This is from Rubina.
Okay. Crying for what? First, you should try to, sort out things like if the baby is hungry, maybe babies are about to pass urine, maybe it has soiled its nappy, or 4-month-old baby, just open out all the clothes and check if any insect has bit anywhere. If all those possibilities are ruled out, because usually the colic, what we are discussing today, ends up by around 3.5 months. So if there is excessive crying, which is very much inconsolable, then please consult your pediatrician once.
Okay, Harshita has just written female child. I'm guessing this was the same question we took up for the
Acting
urine.
while,
Yes.
yeah. Yes.
Okay. From अरफा, माय बेबी इज 9 months old, बेबी कुछ नहीं खा रही है सिवाय ब्रेस्ट मिल्क के, और ब्रेस्ट मिल्क उतना नहीं हो रहा है, क्या करूं? फर्स्ट टीथ कल निकला है।
अच्छा, सी बच्चा एक दिन में खाना नहीं सीखेगा। ब्रेस्ट मिल्क उसने जन्म से लिया